HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system. The immune system is our defense against illness. HIV weakens the immune system by destroying important cells called CD4 cells. These cells are white blood cells that fight off infections. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of HIV infection. When someone has AIDS, their immune system is severely damaged. This means their body can't fight off infections and diseases. HIV is a serious condition. However, with proper medical care, people with HIV can live long and healthy lives. It is important to remember that HIV is not the same as AIDS. Not everyone with HIV will develop AIDS. Early diagnosis and treatment are crucial for preventing the progression of HIV to AIDS. HIV is transmitted through certain bodily fluids, which are essential for the virus to spread from one person to another. These fluids include blood, semen, vaginal fluids, breast milk, and rectal fluids. Each of these fluids can carry a high concentration of the virus, making them potent sources of transmission. The virus can enter the body through cuts or sores in the skin or mucous membranes. Even small, unnoticed cuts can be entry points for the virus. HIV can be spread through unprotected sex, which is one of the most common ways the virus is transmitted. This includes vaginal, anal, and oral sex. Any form of sexual activity that involves the exchange of bodily fluids can potentially transmit HIV. Using condoms correctly and consistently can greatly reduce the risk of HIV transmission. Condoms act as a barrier, preventing the exchange of bodily fluids. Sharing needles or syringes for drug use is another way HIV can spread. This practice can directly introduce the virus into the bloodstream. It is essential to always use sterile needles and equipment. This not only prevents HIV but also other blood-borne infections. HIV can be passed from a mother to her child during pregnancy, childbirth, or breastfeeding. This is known as vertical transmission. However, with proper medical care, the risk of transmission can be significantly reduced. Antiretroviral therapy can greatly lower the chances of a mother passing HIV to her baby. It is important to note that HIV cannot be spread through casual contact. Everyday interactions do not pose a risk. Hugging, shaking hands, sharing food, or using the same toilet seat will not transmit HIV. Understanding these facts helps reduce stigma and misinformation about the virus. In the early stages of HIV infection, many people experience flu-like symptoms. These symptoms can include fever, headache, muscle aches, sore throat, and swollen lymph nodes. These symptoms typically appear within 2 to 4 weeks of HIV infection. However, some people may not experience any noticeable symptoms for several years. This is why it is crucial to get tested for HIV, especially if you have engaged in any risky behaviors. As HIV progresses, it can cause more severe symptoms such as weight loss, persistent diarrhea, skin rashes, and fungal infections. If left untreated, HIV can weaken the immune system to the point where it can no longer fight off infections. Recognizing the early symptoms of HIV is important for seeking timely medical care and preventing the virus from progressing. Preventing HIV starts with understanding the virus and how it spreads. By taking certain precautions, you can significantly reduce your risk of contracting or transmitting HIV. One of the most effective ways to prevent HIV transmission is by using condoms correctly every time you have sex. Condoms act as a barrier, preventing the exchange of bodily fluids. Another important prevention method is regular HIV testing. Knowing your HIV status allows you to make informed decisions about your health and protect yourself and your partners. Avoiding needle sharing is crucial for preventing HIV transmission among people who inject drugs. Needle exchange programs and access to sterile injection equipment are essential harm reduction strategies. For pregnant women living with HIV, taking antiretroviral medications as prescribed can dramatically reduce the risk of transmitting the virus to their babies. Section 5. HIV testing, knowing your status. HIV testing is the only way to know for sure if you have HIV. It's a crucial step in taking control of your health and well-being. It is a simple blood test that can detect the presence of HIV antibodies in your blood. This test is quick and usually painless, making it accessible for everyone. Antibodies are proteins that your body produces in response to an infection. When HIV enters your body, your immune system responds by creating these antibodies. There are different types of HIV tests available, including rapid tests that can provide results in as little as 20 minutes. These rapid tests are convenient and can be done in various settings, including clinics and community centers. Your doctor or local health clinic can help you determine which test is right for you. They can provide guidance and support throughout the testing process. It is important to get tested for HIV regularly, especially if you have engaged in any risky behaviors. Regular testing ensures that you are aware of your status and can take appropriate actions. Early detection of HIV allows for early treatment, which can help prevent the virus from progressing to AIDS. Early treatment can significantly improve your quality of life and health outcomes. Knowing your HIV status is empowering. It gives you the knowledge you need to take control of your health and future. It allows you to make informed decisions about your health and protect yourself and your partners. By knowing your status, you can take steps to prevent the spread of HIV and maintain a healthy lifestyle. Section 6. Living with HIV Antiretroviral Therapy or ART. Antiretroviral therapy, often referred to as ART, is a life-saving treatment for people living with HIV. It has revolutionized the management of HIV, transforming what was once a fatal diagnosis into a manageable chronic condition. ART involves taking a combination of medications that work to suppress the virus and stop it from replicating in the body. These medications target different stages of the HIV life cycle, making it harder for the virus to multiply and cause damage. This therapy helps to restore the immune system by increasing the number of CD4 cells, making it easier for the body to fight off infections and stay healthy. Regular monitoring of CD4 counts and viral load is essential to ensure the effectiveness of ART. When taken consistently as prescribed, RT can help people with HIV live long and healthy lives. Adherence to the medication schedule is crucial to prevent the development of drug resistance. ART also significantly reduces the risk of transmitting HIV to others. By lowering the viral load to undetectable levels, the likelihood of passing the virus on to sexual partners is dramatically decreased. When the virus is suppressed to undetectable levels in the blood, it is virtually impossible to transmit HIV sexually. This concept is often referred to as undetectable = untransmittable, or U = U. Living with HIV can be challenging, but with the right medical care, support, and adherence to ART, people with HIV can lead fulfilling lives. Support groups and counseling can also play a vital role in helping individuals cope with the emotional aspects of living with HIV. Section 7. The impact of HIV/AIDS on individuals and society. HIV/AIDS has had a profound impact on individuals, communities, and the world. The epidemic has claimed the lives of millions of people and continues to affect the lives of millions more. HIV/AIDS can have devastating social and economic consequences. Stigma and discrimination against people living with HIV remain significant barriers to accessing healthcare, education, and employment opportunities. The HIV/AIDS epidemic has also placed a significant burden on healthcare systems worldwide. Providing testing, treatment, and care for people living with HIV requires substantial resources. Addressing the social and economic factors that contribute to HIV vulnerability, such as poverty, inequality, and lack of access to education, is crucial for effectively combating the epidemic. Section 8. Advancements in HIV/AIDS treatment and research. Over the past few decades, there have been remarkable advancements in HIV/AIDS treatment and prevention. The development of effective antiretroviral therapies has transformed HIV from a death sentence to a manageable chronic condition. Scientists are constantly working to develop new and improved HIV treatments. These include long-acting injectables that can be administered less frequently, gene therapies that aim to cure HIV, and broadly neutralizing antibodies that can target and neutralize a wide range of HIV strains. In addition to treatment advancements, there has also been significant progress in HIV prevention. Pre-exposure prophylaxis, or PrEP, is a daily pill that can significantly reduce the risk of HIV infection in people who are at high risk. These advancements offer hope for a future free from HIV/AIDS. Section 9. A future with hope: ending the HIV/AIDS epidemic. Ending the HIV/AIDS epidemic is an ambitious but achievable goal. By continuing to invest in research, expand access to testing and treatment, and address the social determinants of health, we can make a difference. It is essential to combat stigma and discrimination against people living with HIV. Creating supportive environments where people feel comfortable disclosing their status and seeking care is crucial. We must also prioritize education and awareness campaigns to prevent new infections. Empowering young people with the knowledge and skills to protect themselves is essential. Ending the HIV/AIDS epidemic requires a collective effort. By working together, we can create a healthier and more equitable future for all.